শুনতে পাচ্ছেন?
হ্যাঁ, আসসালাম। আপনাকে পোস্ট করে দিচ্ছি।
হ্যাঁ, দেখতে পাচ্ছি।
নজরুল ভাই,
আসসালামু আলাইকুম।
আসসালামু আলাইকুম।
ওয়ালাইকুম
কেমন
আসসালাম।
আছেন স্যার?
আলহামদুলিল্লাহ, আপনি কেমন
আলহামদুলিল্লাহ।
আছেন?
হ্যাঁ,
স্যারকেও তো পোস্ট করে দিয়েছি, আপনি প্রেজেন্টেশন শেয়ার করতে
নজরুল ভাই আমাকে শুনছেন?
জি, শুনছি শুনছি ভাই।
আর সালামটা গ্রহণ করেন, আদাব দিচ্ছি।
জি
প্রথম দলপতি।
জি 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 জি, দাদা আপনার নাম দেখা যাচ্ছে।
আসসালামু আলাইকুম স্যার, ভালো আছেন?
ওয়ালাইকুম আসসালাম ওয়া রাহমাতুল্লাহ, আলহামদুলিল্লাহ।
কেমন না?
ব্যাকগ্রাউন্ডটা চুজ করতে পারলাম না যে
ও স্যার,
নজরুল সাহেব
স্যার ওইখানে লগইন আগে আপনার
না দেখছি, আমি দেখছি ব্যাকগ্রাউন্ডও নেই আমার কিছু নাম
আচ্ছা, মানে আরেকটা ক্রিয়েট করতে পারবেন।
আমি দেবো, অসুবিধা নেই, অসুবিধা নেই। জি জি জি, ওকে। আমার মনে হয় আমরা
জি,
কথাবার্তা শুরু
পাটোয়ারি
করতে
ভাই
পারি।
আপনি ফলো নেন।
থ্যাংক ইউ। আমরা স্যার 1 মিনিট সময় দেবো স্যার।
জি আচ্ছা, নজরুল সাহেব, আমি আমি তো আমি তো ওই যে আমার 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 পাওয়ার পয়েন্টটা
জি
প্লে দিয়ে শুরু করলে তো ভালো হবে
হ্যাঁ,
নাকি? প্লে দিয়ে রাখবো না
ওই সময় ফেলে দিয়ে পরে অনেক ফেলে দিলে ওখানে দেখেন মানে অন্য একটা সেকেন্ড উইন্ডো ওপেন হইলে
আচ্ছা
ওইটা আর শো করে না। এটা হলো যে আপনার ল্যাপটপের প্রেজেন্টেশন মোডের উপরে নির্ভর করে। এই স্ক্রিন এসছে, এবার প্লে করেন।
মানে মানে বড় আকারে আসছে,
হ্যাঁ প্লে হচ্ছে প্লে হচ্ছে
প্লে হচ্ছে। আচ্ছা ঠিক আছে, আমার মনে হয় আমরা কথাবার্তা শুরু করি, কিছুটা আমরা হয়তো রিক্যাপিচুলেশন করবো, তারপর আসলে সাবজেক্টে যাবো 5 মিনিট পরে।
ঠিক আছে, আমি স্যার সবাইকে মিউট করে দিই, সবাইকে
মিট করে দেখি, করে দিয়ে পাঁচবার হিসাব নাই আজকে।
আমি শুনতে পাচ্ছি।
হ্যাঁ, তাইলে আপনি মিট করে দিলে আপনি।
এবার আপনারা স্যার এবং পাটোয়ারি ভাই আনমিউট করে নেন, আপনার পোস্ট করা আছে।
জি হ্যালো,
জি স্যার,
জি ঠিক আছে।
পাটোয়ারি ভাই আপনি ফলো শুরু করেন।
জি জি, আমি 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 আরেকটা আইডি থেকে বের করছি।
আচ্ছা আচ্ছা, একটু বলে দেন যারা এই যে অরিজিনাল নামে যারা নাই তাদেরকে তো আমরা রেকর্ড করতে পারবো না। যেমন একজন আছে গ্যালাক্সি J3 প্রো, উনি জন্য নামটা চেঞ্জ করেন একটু, সব বলে দেন সবাইকে।
সম্মানিত উপস্থিতি, আপনারা জানেন যে বাংলাদেশ হোমিওপ্যাথিক পরিষদ একটা সিদ্ধান্ত নিয়েছেন যে যারা রেগুলার ক্লাসে উপস্থিত থাকবেন তাদের একটা পুরস্কারের ব্যবস্থা করা হবে। তো আমরা সেভাবে অ্যাটেন্ডেন্সটা নিচ্ছি প্রতি ক্লাসে। তো এখানে যাদের নাম আছে তাদেরকে কিন্তু আমরা চিনতে পারছি বা তাদের নামে আমরা নিতে পারছি, কিন্তু যাদের নাম নাই, ডিভাইসের নেম, যেমন রেডমি নোট 11, উনি কে আমরা কিন্তু জানি না। এখানে এরকম যারা আছেন তারা আপনারা রিনেম করে নামটা দিয়ে নেবেন, তাহলে আপনাদের দেখা যাচ্ছে উপস্থিত থাকছেন এবং আমরা কাউন্ট করতে পারবো আপনাদের উপস্থিতি, এবং সেভাবে আপনারা হয়তো বা পুরস্কারের জন্য একজন দাবিদার হতে পারবেন। অথচ আপনি যদি রিনেম না করেন, নাম না থাকলে আপনি উপস্থিত থাকলেও কিন্তু আপনাকে রিকগনাইজ করা যাবে না। তো এটার আপনারা সবাই রিনেম করে নেবেন আর এখন মোটামুটি দেখছি সবাই করছে স্যার।
আচ্ছা,
একজন শুধুমাত্র
ঠিক আছে। আমার রেপার্টরিটা গেছে, রেপার্টরিটা
রেপার্টারি না স্যার, ওই
রেপার্ট
ওই স্ক্রিনটাই আছে। না, রেপার্টারি আসছে নাই, ওটাকে আবার ডিসকানেক্ট করে স্টপ করে তারপরে শেয়ার করতে হবে।
ও আচ্ছা 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 আচ্ছা, বুঝতে পারছি। তাইলে তো আচ্ছা আচ্ছা, বুঝতে পারছি। share. গেছে না
হ্যাঁ
রেপার্টরিটা?
এবার এসছে।
এবার আসছে।
হ্যাঁ, আরেকটা আছে স্যার, ডেস্কটপটা যদি শেয়ার করা হয় তাহলে ডেস্কটপ শেয়ার করে ওটাকে আবার সুইচ করা যায়।
হ্যাঁ
যদি ডেস্কটপ শেয়ার করা হয়
হ্যাঁ
ওটা আবার মানে
হ্যাঁ,
শেয়ার করার
কোথায়?
সময় ডেস্কটপটা শেয়ার করে নিতে হয়। শেয়ার
তাই
করার
না?
সময় ওটা ডেস্কটপ শেয়ার করলে আপনার
হ্যাঁ হ্যাঁ,
তখন যেটা শো করবেন সেটাই show হবে।
কোথায় শেয়ার করবো?
স্যার ওই যখন
কোথায় share
শেয়ার
করবো?
করবেন তখন
Share-
হলো
হ্যাঁ,
ডেস্কটপ দেখবেন যে ওখানে
আচ্ছা আচ্ছা আচ্ছা।
ওই শেয়ারে যে আমি আমি
শেয়ারই ডেস্কটপ
হ্যাঁ।
শেয়ার অপশনটা।
হ্যাঁ আমি তো এখানে আছে অ্যাডভান্স বেসিক শেয়ার। আচ্ছা দেখি তো শেয়ারটা।
আচ্ছা, রেপার্টরি দেখতে পাচ্ছি।
না রেকর্ডিং দেখতে পাচ্ছেন কিন্তু
রেপার্টারি আসতেছে। ওই যে ডেস্কটপ শেয়ার করলে হয় কি স্যার, যেটাই সুইচ করতে সেটাই
হ্যাঁ,
সরাসরি
সেটাই
দেখা
দেখা যায়। তো এন্টার স্ক্রিনটা চলে আসছে।
স্যার এখন আপনি মনে হয় যেহেতু আজকে ইয়ের সময় হয়ে গেছে, আপনি পরে এক সময় এটা ট্রায়ালটা দিয়ে নিন।
জি জি জি।
জি
আচ্ছা আমি তো দাঁড়া 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 দাঁড়া, আমি তো পুরাটা দেখতে পারতেছি না যে। তো শেয়ার আমার স্ক্রিনটা বড় করার উপায় কি?
কোনটা স্যার?
আমার আমার উইন্ডোটা বড় করার উপায়
আপনার
কি? পিন দিব, পিনে দিব।
ওটা এটা স্যার আপনারটা এখানে আমি পিন করে দিব, অসুবিধা
আচ্ছা
নেই। আপনি
হ্যাঁ,
স্পটলাইট করে দিব,
হ্যাঁ,
সবাই
বুঝতে
দেখতে
পারছি।
পারবে। আপনি শেয়ার করলে
আচ্ছা
স্পটলাইট
ঠিক আছে,
করে
আমার
দিলে
মনে হয়
সবাই
আমরা শুরু করতে
কাছে
পারি।
চলে যাবে।
জি আমার মনে হয় আমরা শুরু করি।
স্যার আমরা আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু। প্রিয় উপস্থিতি, সবাইকে বাংলাদেশ জানাচ্ছি। উপস্থিতি, আপনারা জানেন আমরা প্রতি সপ্তাহে রবিবার এবং বুধবার বাংলাদেশ সাংস্কৃতিক পরিষদের পক্ষ থেকে উচ্চতর অনলাইন আলোচনায় আমরা ভিত্তির বিভিন্ন দিক, বিভিন্ন বিষয় নিয়ে আমরা আলোচনা করছিলাম। তো আমাদের ব্যাটারি মেডিকেল অত্যন্ত গুরুত্বপূর্ণ একটি মেডিসিন, ল্যাকটেসিস। এই মেডিসিনটি নিয়ে আমাদের সম্মানিত সভাপতি ডাক্তার শেখ ফারুক ইলাহি স্যার ধারাবাহিক আলোচনা করছেন, এবং আমাদের ক্লাসগুলো আমরা নিয়মিতভাবে প্রথমে ইংরেজিতে এবং পরে বাংলায় আমরা এগুলোকে আবার আপনাদের সামনে উপস্থাপন করার চেষ্টা করি। সেই হিসেবে আজকে আমাদের ইংরেজি ল্যাকটেসিস আলোচনায় আমরা পার্ট 3 আলোচনা করব, যদি সম্ভব হয় স্যার হয়তো আজকে ইংরেজি পার্টে শেষ ক্লাসটি করবেন। আরেকটি বিষয় আপনাদের কাছে আমরা জানিয়ে রাখি, আমাদের রমজান মাস উপলক্ষে আমাদের এই অনলাইন ভিত্তিক উচ্চতর প্রশিক্ষণ ক্লাসের যে নিয়মিত সাপ্তাহিক আয়োজনটা থাকে সেটি বন্ধ থাকবে। আমরা ঈদের পরে আবার আমাদের আলোচনাগুলো শুরু করব। তো আজকে সেই হিসেবে আমাদের রমজানের পূর্বে সর্বশেষ ক্লাস। আর একটি বিষয় আপনাদেরকে আমরা বলে রাখি, যেটা আমাদের সম্মানিত ভাইস প্রেসিডেন্ট নজরুল ইসলাম খান ভাই বলেছেন, যে আমরা যেহেতু সিএইচএমই কন্টিনিউয়াস হোমিওপ্যাথিক মেডিকেল এডুকেশনের আওতায় আপনাদেরকে একটি কন্ট্রিবিউটিং সার্টিফিকেট আমরা প্রদান করব। সেই হিসেবে আপনারা যারা ক্লাসে যুক্ত হবেন, আপনাদের ডিভাইসের নামগুলোকে, যেমন এখন একজনকে দেখতে পাচ্ছি ভিভো V2204 এই নামে আছেন, আপনি আপনার নামটাকে রিনেম করে নিলে আপনার পুরো নামটা আমরা সার্টিফিকেট প্রদানের ক্ষেত্রে এবং আপনার অ্যাটেন্ডেন্স কাউন্টিং এ আমাদের জন্য সুবিধা হবে। এবং আমাদের যে অনলাইন ভিত্তিক এই ক্লাস পরিচালনায় আমাদের একটি কারিগরি টিম আছে, যারা এই বিষয়গুলোকে প্রতিনিয়তই লক্ষ্য করেন এবং আপনাদের সার্টিফিকেট প্রদানের সুবিধার্থে আমরা এই বিষয়গুলোকে পুঙ্খানুপুঙ্খ রূপে যে যাচাই বাছাই কমিটি আছে আমাদের, তারা তাদের কাজের সুবিধার্থে আপনারা এই বিষয়গুলোকে একটু ফলো করবেন। আর অনাকাঙ্ক্ষিতভাবে, যেটা এখানে হয়তো খুব কমই হয়, মাইকটা মিউট থাকে এবং ভিডিওটাও পারতপক্ষে কেউ অন করবেন না। এতে ক্লাস পরিচালনায় এবং যিনি ক্লাস নিচ্ছেন তার মনোযোগে ব্যাঘাত করতে পারে। তো খুব বেশি কথা না বলে সরাসরি আমরা আলোচনায় চলে যেতে চাই। আলোচনায় আমন্ত্রণ জানাচ্ছি আমাদের বাংলাদেশ হোমিওপ্যাথিক পরিষদের সম্মানিত সভাপতি ডক্টর শেখ ফারুক ইলাহি স্যারকে। স্যার, প্লিজ কন্টিনিউ ইউর presentation. Thank you.
Yes, thank you, Dr. Anwar Patwari, for the introduction. This is our English version, and this is the 4th class. And I hope we'll take one more class to finish it, because it's a very big medicine. The last class, we finished the mind section. So this class, first I will show you the repertory rubrics of the mind chapter of lechesis, then we'll go to particular symptoms. So just let us recapitulate the main mental symptoms of lechesis, then we'll go for repertorization. So we told you that Dr. George Vitolkas, he gave an important observation on lechesis symptomatology, or its mental symptomatology, that lechesis has 2 phases of its mental state. One is overstimulation or extrovert type, another is introvert type. We discussed last class, so I am not going into details. Just I say that this extrovert type or stimulated type can occur in one patient, and introvert type can occur in another patient. So maybe you get the introvert patient, and if you don't know the introvert symptoms of lechesis, then you will miss lechesis in that case. That's why you will have to know both ways. Now, maybe these 2 stages will be present in 2 patients, in one extrovert, another one introvert, or it may present in the same patient. So a few months you will be in the overstimulation state, extrovert state, followed by a period of introvert state. We see in psychiatric patients, it is called bipolar disease, manic depressive psychosis. They have a phase of mania and they have a phase of, say, psychosis. Just you will be taciturn, introvert, then again the manic phase will come, then again the introvert type will come. So it may be in same patient in a alternating way, or it may be present in the same patient in the same day. In the morning he will get up from the sleep, he will be introvert state. He is sad, he does not like anything, and he is very much annoyed, he is taciturn, does not speak. And in the evening, the same patient may go to the overstimulation stage, extrovert stage. He becomes euphoric, he becomes talkative, like this. So lechesis patient is a little complicated patient, because we see in the proving itself, when a lechesis patient, when a lechesis snake bites a patient, it stimulates the patient. Patient becomes very worried and he becomes restless, painful. He cannot sleep like this. But after some time, a stage comes when he becomes taciturn, he becomes weak, he becomes, I would say, having delusion, delirium, muttering. You cannot understand his speech like this. So in the proving itself, there are two stages. So we'll see the repertory rubrics of both the stage when I will see the repertory. Now, let us go to the first symptoms. We said there is suspiciousness. Leakage is very much suspicious. He suspects everybody, even his wife, his husband, her husband, parents, children, and everybody in the house, her servants, drivers, and friends, and everybody. So we discussed already in the last day. Today we'll see it's a repertory rubrics. So suspiciousness is one thing you find. Then second thing with jealousy. Leakage is very jealous. Even a small child of 3 years, he has jealousy over his brothers who was born 1 year before. So he finds that his parents give more affection to him. That's why this 3-year child, he becomes jealous. So jealousy occurs even in a small child. Then selfishness. They are very selfish. They are critical. They criticize others. They are censorious. They always think of bad thing for others. Then they mock others. Mocking means just to laugh over another one, to undermine his personality. So these features are in leakages, and we see in the repertory how it is represented in the repertory. Then we found he is very much proud, very haughty, and he is a dictatorial. He does not like any authority, and he will authorize everybody. It is like this. It is more than like a podium. So we also discussed last day. Then the next symptom is loquacity. He is very loquacious here, volvulus, talks too much, and he has various features in his loquacity. He will rapidly change the subject from one subject to another, and he is talking one word, particular word, will take him to another subject, and he will jump to another subject, leaving the first one. It is like this. And sometimes he will finish the sentence in the midway, and he will think that the rest of the sentence you will understand yourself. It is like this. Loquacity. Then we discussed about delirium. He has so much delirium, because we find in the proving after the biting of like a snake, the patient becomes very drowsy. He becomes delirium. That's why this medicine is an useful medicine in typhoid fever, typhoid, paratyphoid, blood poisoning, sepsis. For this, because he will have muttering delirium in that state. Then there are so many anxieties in a leukemia patient. Particularly, we discussed last day, he has anxiety about health, that he will die of heart disease. He has so much anxiety about his heart, though his heart is normal maybe, but he will think that he will die of his heart disease. This is a very specific symptom of leukemia. But interestingly, I will tell you, I will show in the repertory, this is a very important intensified symptom in our materia medica from various authorities. But you find in the repertory, it is not represented in that way. It is represented by third grade. So it is said that the repertory should be updated time to time. So this symptom is third grade in repertory. It should be increased to second grade or even the first grade. So we'll see in the repertory sometimes it does not tally with the sense of or the intensity of symptoms of the materia medica. Then he has various fear. Most is snakes. His fear is most important fear is fear of snake, and we discussed last day. That's why I'm not going into details. Then he has some religious affection. Sometimes you find some patient, they were not so much religious, but suddenly he became religious. And always he will pray, he will go to mosque, he will go to tabligh, he will go to religious functions. And he is thinking much about his salvation in the day after the world. That he will think that God will punish him and he will not go to Jannah, he will be thrown into hell, something like this. This is called religious affection, religious insanity. This is too much in Lachesis. We'll see that about it also. Then he has weakness of memory. Particularly he has disturbance of time sense. Always he will ask somebody, oh, what is the time now? Is it morning? Maybe this evening. He will say, this is morning. He will say, this is the, say, 25th Ramadan. No, Ramadan did not start at all. So this is an important symptom of Lachesis, disturbance of time sense. Then he has so many delusion and hallucinations. Delusions and hallucinations. He will think that he is controlled by superpower, by a supernatural power upon him, and that superpower is directing him. Do it, don't do it, something like this. And he will do according to the order of the superpower. This is called delusion and hallucination. We find if you treat psychiatric patient, particularly schizophrenic patient, that symptom too much. And there is another medicine, it is anacardium. These two are very neck and neck. Sometimes in schizophrenic patient, you find exactly what anacardium symptom is that one force or one feresta will talk in his right ear that do these good works. He will say, these are the good works, do it. And another shaitan, Iblis, will come to his left ear and he will say, don't do it, don't do it. So he will be in a dilemma, what to follow. The one who is talking on the right side or on the left side. This is more in anacardium, but less in Lachesis. What is more in Lachesis, that he thinks one superpower is controlling him. This is a delusion. And we find it in psychiatric patients, particularly schizophrenia. And many schizophrenic patients who have more symptoms of Lachesis. Lachesis is not a medicine. If you well select in a case of tough psychiatric disease, you can even cure him. Now, there is dualism in Lachesis. What is dualism? He has two types of personality. Sometimes he is arrogant, but sometimes he is very, humility patient. Say he is not having any anger. Sometimes he will criticize so many people. He will criticize. He will talk too much. But sometimes you find he is very silent. He is very taciturn. So he has sometimes much religious minded. He will always talk of religion. And sometimes you find he is an atheist. He does not even believe in God. So it is called dualism. There is a dual type of mentality in Lachesis. This is very important. If you find this duality in his mind and he has irresolution to take any decision, he cannot take decision because he has this side and that side. So he's in confusion which way he will go. So this is a very good symptom of Lachesis. And these symptoms are emphasized in modern Materia Medica books like Catherine Coulter, Whitmont. These are very good books of modern Materia Medica of homeopathy. Then you find sexuality. Sometimes, as I said, he has duality. He's too much thinking of sexuality, like platinum, like acid flow patient. He always think of doing sex and also bad sex or perverted sex. But sometimes you find the same person, he is very much he hates sex. He is away from sex. So you may find in the same patient both way, or you may find in one patient too much sex thinking, another one against sex. So both symptoms belong to Lachesis. Religion, I already told you. Now about a legacy child. I told you that legacy child, even legacy child, if you know the legacy symptom, you can spot legacies in a very small child. As I said, they are very arrogant type of child, and they are very jealous, like the adults. As I said, the brother will be jealous of his younger brother, who is maybe only lactating child, because he finds that his place has been taken by this small one after birth. That's why when mother is away, he will beat this child. He will beat his brother because he's jealous. And he will not take any order from his father and mother. He will say, no, I will not do. It is such arrogant, this like his child. And you find also that he will not allow any authority upon him. When you send him to the school, you find that he argue with his teacher. He does not like the order of teacher. Teacher says, tomorrow you bring this homework. He will not bring the homework. And he will argue with the teacher. So you find the legacy child even in this age. And you can spot out legacies. And if you give legacies, it will make the child a very sober child. So this much about legacies mind symptoms. Now we are going to show you the repertory rubrics of legacies mind. Okay, now I told you that legacies has, can you see the repertory? Hello? You see the repertory?
জি স্যার, দেখতে পাচ্ছি স্যার।
Okay, thank you. So I told you legacies are two types of personality, extrovert type and introvert type. In extrovert type, what are the rubrics? You find communicative, loquacity, speech fluent, ideas abundant, thoughts rush. So let's show you communicative. You see, communicative. Communicative means he can talk with anybody, he will mix with anybody, and he will make friends, and he can talk in a good way so that he can convince others. So let us see there, this one, communicative. You see legacies in the second grade. Phosphorus is first grade, because we know Phosphorus is a society girl. She is too much communicative, but legacy also communicative. Then we see loquacity. This is the highest grade in legacies. So let us go to loquacity. But I tell you, in some patients, you may not find loquacity. So you find many other symptoms, but you think, oh, this patient does not speak much. How can I give legacy? Yes, still you can give, because he has another picture. Now this loquacity, you see, loquacity has legacies in the super grade. Other medicines are there, hyoscyamus, stramonium, but they are in the third grade, first grade, but this is super grade legacies, loquacity. Then you find speech fluent. He speaks fluently, very fluently. He does not stop anywhere. So let us see speech fluent. These are extrovert type of symptoms. Speech fluent. You see, speech fluent. Speech fluent, there are 8 medicine, and that is legacies as well. Legacies also. Then ideas abundant. He has so many ideas in his mind. He cannot accommodate all the ideas in his extrovert phase. So let us see ideas abundant. So many ideas. So ideas abundant. Ideas abundant. Ideas abundant. You see, ideas abundant legacies first grade. Other medicines are there, opium, phosphorus. Phosphorus always you find with legacies, because phosphorus is very communicative. They can talk very nicely in a convincing way. So legacies in the first grade, these are ideas abundant. then thought rush. He's thinking, rushing one after another. So thought rush. I am showing you this repertory. This is a way of learning mathematics, I tell you. Before I I can say that I started learning homeopathy in 1977. I was admitted in THMS, Homeopathic College. Up to 1988, I passed in 1981. Up to 88, I was studying Mathematica as it is. But from 88, some of my guru, European guru, they advised, no, you study a medicine from Mathematica as well as from repertory. Then your study becomes complete. From that time on, I am doing this thing. Now you see, what we talked about Lachesis Mathematica, now we find in the repertory itself. So this gives you a very good hand in doing repertorization, and also you can judge the symptoms. So we see here, thoughts rush, thoughts rush, rush, R-U-S-S, rush, thought rush. You see, Lachesis fast grade. One means there is flow of thoughts, one after another. He non-stop thinking, non-stop giving ideas, abundantly, fluently. So these symptoms, these rubrics belong to the extrovert phase of Lachesis. Now let us see the introvert phase, how it is represented in the repertory. So introvert phase will be represented by reserve. The patient is reserved, he doesn't talk. He has inhibition. He is inhibited. He has no stimulation. It is called inhibition. Then company aversion too. He does not like any company. Then taciturn. Taciturn means nirbag, mono. He's just silent. He doesn't talk. These are the rubrics representing the introvert type. So let us see reserve. Reserved. Reserved. You see reserved. Reserved here, Lachesis is in third grade. Now you think, here Lachesis, you find in other symptoms also, in this introvert type, third grade. Why? Because the main phase or dominant phase of Lachesis is extrovert type. So you found all the rubrics of extrovert type, first grade, super grade like this. But it means the reserve state of Lachesis is less. You find less in patient. That's why here it is third grade. Now let us see inhibition. 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 You see, Lachesis, only there are three medicines: Ambragracia, Lachesis, and Strepsirrhea. Inhibition means he does not have any stimulation. He is always sitting. So here also Lachesis. Then you find company aversion too. He does not like any company. He wants to be alone. So let us see company aversion too. Company aversion too. Aversion too. You see, company aversion too. You find Lachesis in the second grade. I told you because you don't expect in this inhibition stage, introvert stage, Lachesis. So it gives you the idea that you find most Lachesis symptoms in the extrovert phase. But still, you will find some patient in the introvert stage. And if you don't know this symptom, you will miss Lachesis in such patient. You may give Nestramur, Ignitia, Strepsirrhea in such patient. Or maybe it was Lachesis. Then you find taciturn. Taciturn means he is silent. He does not talk. He has no expression. So come to taciturn. Taciturn. You see taciturn. Again, you find Lachesis. You see in the third grade. What does it mean? It means only few patients of Lachesis you will find in taciturn phase. Mostly they will be eloquent, talkative like this. So this is the two phase of legacies in repertory. Now we find memory, weakness of memory. Maybe most of us, we don't think about legacies in weakness of memory. We think maybe lycopodium, maybe medullarium like this. But legacies is also in first grade, weakness of memory. So let us come to weakness of memory. Memory weakness. Memory. Memory, weakness of memory. You see, legacies first grade. You see, legacies first grade. You see here, legacies first grade. So even legacies has weakness of memory like medullarium. Medullarium first grade, also this is first grade. Then you find, I told you, this legacies, this extrovert introvert type, they alternate maybe in the same patient. In the morning, introvert stage, in the evening, extrovert stage. Or maybe in 2 months before he was extrovert, now he is taciturn. So there is also another rubric. This is called mania alternating with depression. Sometimes he is manic. He will beat person, he will scold person, and sometimes you find that he is depressed. So there is also rubric of legacies. We find this is called bipolar disease, this psychiatric disease, manic depressive psychosis. And legacies is a good medicine if it fits the patient to cure it. So mania. Sorry. Mania alternating with depression. You see, mania alternating with depression, and you find legacies is the only medicine in first grade. So we will think that we may find a legacies patient in manic phase, extrovert phase, or we may find him in the introvert phase. Both are legacies. So this is mania depressed alternating with depression. This is the only first grade medicine, legacies. Now we come to the second symptom, suspicious. Legacies too much suspicious, more than hyoscyamus. So let us see suspicious. I think it is better if you are very serious to learn. When we learn mathematics, we are very serious. We take paper to note something. So here you can take your repertory with you, maybe cancer repertory or synthesis repertory with you, and you can learn. You can just find out like me the rubrics and you can learn. And at the same time you learn legacies more. So we will see suspicious. You see suspicious. Legacies is so suspicious. You see suspicious legacies first grade. But you see, by repertorization, you learn mathematics more. Why? You see here, lycopodium. This is super great, more than legacies. So lycopodium patient is more suspicious than legacies. So by this rubric, you learn a symptom of lycopodium also. The lycopodium is so suspicious. Lycopodium does not believe or does not believe his wife. He suspects, or lycopodium wife cannot believe his husband. When the husband comes a little bit late at night, she will not think that he was stuck to his. She will think that he may have gone somewhere else, something like this. So lycopodium is more suspicious. So you see, repertorization gives you a chance to learn more medicine along with your the stipulated medicine. Now let us come refusing medicine to take. Lycopodium patient will not take medicine from you. Maybe his wife is making the medicine, say homeopathic medicine. He will not take. Oh no. Maybe she has given some poison. So he refuses medicine. due to his suspicion. Let us find the rubric refusing medicine. Refusing medicine. Refusing medicine. Refusing medicine, you see, to take. You see, leprosy is the only first grade medicine. Even hyosamus is second grade, you see. Even hyosamus is second grade. Hyosamus is very suspicious. But leprosy you find is a first grade suspicious medicine. He does not take medicine from his wife even. Then you find delusion. He has some delusion. He thinks that somebody is after him. They want to harm him. Maybe there is nobody. There is nothing like this. But he thinks that people are pursuing him. Government is pursuing him. Police is pursuing him. They are following him to catch him in some fault. But this is delusion. The false belief. So let us see this one also. Delusion pursued he was. Delusion pursued. Delusion pure. You see, delusion pursued. This is hyosamus is here more. Hyosamus is second grade, leprosy is third grade. He was pursued. Now jealousy, we come to jealousy. Leprosy is too much jealous. And you find also there is another medicine, jealous. So let us see. That's why repertory is giving you one instruction. It is giving you cross-learning of mathematics of other medicine. So we find jealousy. Jealousy. You see, in jealousy, there are three medicines. Nux is first grade, also jealous. Then hyosamus and leprosy is super grade, means more than first grade. So these are very, very jealous. And hyosamus and leprosy, of course, it is easy to differentiate them, but it's some symptoms, they are very near. So jealousy, it is super great in leprosy. Then you find censorious. Censorious means he criticizes others. We are told that this leprosy persons are very critical. They always criticize others. We have also some friends. They always criticize other people. They are not good. I am only good. Something like this. So these are leprosy mentality. So we find criticize others. So you don't find criticize in repertory. That is term is called censorious, to criticize others. So we see censorious, C-E-N, censorious, you see. And one thing you see, one of my allopathic friend means he was the professor of Government Homeopathic Medical College. He was professor of community medicine. He started one postgraduate diploma course in his institution, and he took me also as a teacher. This Mohsinuzzaman, then Diman, I think, then Ikhtiaruddin, maybe they were our students at that time in that course. So he was an allopath, though he was teacher of homeopathy college. He said, "Oh my God, to learn homeopathy, it is so tough. Very good words, English words I am learning from homeopathy." And you see, these are very chosen words which express the inner sense of the patient. So always when you are dependent on Bengali books, you don't learn the essence of homeopathic medicine. So you'll have to try to learn more English to learn more homeopathy and more homeopathic materia medica. Censorious here, leprosy is second grade. You see, second grade. More are viridium album and then sulfur and arsenic. Censorious. Then we find mocking other, mocking. He will laugh upon others. He will make story and make other people low. This is called mocking. উপহাস করা, উপহাস করা, ঠাট্টা করা, বিদ্রুপ করা. This is mocking. So let us see mocking. This word in our repertoire also. So let us see mocking, mocking, mocking. So you'll have to learn these words also. Mocking, mocking. If mocking, like this is second grade. CPI is first grade. Mocking. Then you find this is called malicious. This is a very important symptom of legacies. Malicious. Malicious means to think of bad of others. That Anwar Patwari is very bad one. And he will say that words about him to others. Don't mind Anwar Patwari, just I mentioned the name. Maybe he will say, oh, Dr. Farukal is very stupid one, notorious one. He does not know homeopathy more. He came from allopathy and he gives allopathic medicine along with homeopathic medicine. So he will say something like this. Why? To undermine others' personality. He wants to increase his personality and by the exchange of others. So this is called maliciousness. Also another term, vindictiveness. Vindictiveness. Pratihingsha pora. He want to size others. Then spiteful. Also like this. Akrushpodo. Spiteful. These are all words applied to legacies. So let us see in the repertoire also. Malicious, malicious, very bad word. If you always criticize another one, he want to undermine another friend in front of others. This is called maliciousness. This is legacies. Maliciousness, malicious. So we'll have to learn good English to learn good homeopathy. Malicious, you see, malicious. Here more is anacardium. Here legacies is second grade. That's why we say this repertoire needs evaluated, improved, because this malicious you find in all the materia medica. This legacies is highly malicious, but in the repertoire it is second grade. It means it needs to be upgraded to the first grade. Maliciousness, spiteful, vindictiveness. Now you find haughty. Haughty means proudy. Oh, I'm the big one. Nobody's above me. All are below me. So proud. So you find the word haughtiness. Haughtiness. H-A-U. Haughty. Haughty. You find this sort of people among us, among your friends, among your relatives. Haughty people. Haughty. Too much haughty. Lycopodium and platinum. You see lycopodium? Maybe when you study lycopodium in your materia medica, you don't know. The lycopodium is so haughty. It is super great. It is much more than legacies. You see? Legacies is second grade. Lycopodium is in first grade. Platinum, of course, is proudy. But even legacies is in the super grade. So you are learning materia medica of other medicine by doing repertoire. Now, loquacity, changing quickly from one subject to another. This is a characteristic of legacies. He will talk, and not talking in one subject. He will half finish one subject, then switch over to another subject. Let us see. Loquacity. 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 Changing. No. Loquacity, changing quickly from one subject to another. Exactly what Mathematics said. This is in the repertoire. You see, this is the only first grade medicine in the repertoire. They change quickly from one subject to another. There is no end to their story. So this is a very important symptom of legacies. So studying medicine from repertoire gives you the idea of the evolution of symptoms. This is a very intensified symptom or less intensified symptom. Now let us see another word, speech wandering. Same thing, quickly changing one subject to another. Speech wandering. He is wandering. We see pains are wandering from one part to another. Lachesis wander from one subject to another. So another rubric, speech. Speech wandering, you see, speech wandering. You see, Lachesis in the first grade. Of course, it should be in the first grade. His speech is wandering. Talking, wandering means traveling from one subject to another, from politics to literature, from literature to medicine, like this. Now, delirium muttering, because we know Lachesis is a good medicine for typhoid fever, paratyphoid fever, blood poisoning, sepsis. So in that stage, patient has delirium muttering. So Lachesis is one of the medicines. So let us see also, this is delirium muttering. Delirium muttering. Delirium. Delirium muttering. Muttering. You see, there is Hyoscyamus, you know, this deliric medicine, we know in the repertory 3 big medicines, belladonna, Hyoscyamus, stramonium, and also Lachesis in the second grade. So there is muttering delirium. Even in typhoid fever, Lachesis is used in typhoid fever with muttering delirium, and like this. Later you can see in the typhoid fever, typhoid fever. You see, there are Bryonia, of course, a good medicine of typhoid fever, and also you find Lachesis in the second grade, typhoid fever. Now this is another symptom. We said that Lachesis has much anxiety about his heart disease. He thinks that he will die of heart disease. And this is a very intensified symptom in all the modern book of Materia Medica. So let us see in the repertory how it is represented. So let us go mind, delusion, heart disease. It's here, heart disease. You see. Now, what do you think? This is so important symptom in Materia Medica, but in the repertory, it is represented by third grade. You see, delusion. He thinks he has delusion that he is having a heart disease. This is Lachen in the second grade, Kelliers, Nectamcar second grade, but Lachesis in the, you see, in the third grade. So when you study repertory in Materia Medica, you can also criticize and evaluate the repertory. You can send a report to synthesis authority that this symptom, I think it should be upgraded to second grade, and you can give the reference. And if you send 50 such symptoms and they accept your 50 symptoms, they will include your name as a contributor in synthesis report. You will find your name there. So I think this grade should be increased to at least second grade. Also, you find he's in fear. He has fear of heart disease. Fear, heart disease. Fear, heart disease of heart. You see, also fear of heart disease. You find here Lachesis. This is in the Lachesis in the third grade. So it should be evaluated. It should be elevated to second grade at least. Now let us go to fear of snake. You see, we think that fear of snake is too much in Lachesis. No, it is more in Lichen. When we will study Lichen in the next chapter, next phase, you will be very happy to know the comparison between these two medicines. Sometimes some people, they mistake Lachesis for Lichen and mistake Lichen for Lachesis. You have to learn it very well to differentiate and correctly prescribe in a patient. So fear of heart disease is a very important, fear of snake is a very important symptom of Lachesis. Fear snake. Let us see how it is in the repertory. You see, in the repertory, there are another snake medicine, Elapsus heart disease, fear of snake, and Lichen. Lichen is not snake medicine, but it has most fear or about snake, more than Lachesis. Lachesis in the second grade and Lichen in the first grade. So when you study Lichen, these two medicine, I tell you, if you learn very well Lachesis and Lichen, I think you will miss less patient having such symptoms. Or if you don't learn these two medicine by differentiating their points, you may mistake giving Lichen in a patient of Lachesis and giving Lachesis in a patient of Lichen, because they are very near their symptomatology. That's why we need to learn very well. Of course, we will do it. Now you come, we said that Lachesis is a religious affection. They think of religion too much. They are fanatics. They are fanatics about religion. And he is very pious. He is very religious, but he thinks that he did not do anything and God will punish him. So this is called religious affection. You find in some patients. So let us see in the repertory religious affection. Religious affection. Religious affection. You see, religious affection. Lachesis in the second grade, like also, and there is also Viretra mode. So Lachesis as religious affection, this is the important symptom. Then too occupied with religion. If we say he is too occupied, he does not think anything. He is a doctor, but he does not go for practice. He is going to mosque here, there, and always thinking that he will not go to Jannah, he will go to hell. So this religious affection, let us see another rubric, very nice rubric. This is religious affection. Religious affection. Religious. Too occupied with religion. He is too occupied with religion. Always think of religion. Let us see. You see here, first grade. First grade is Lachesis, Lilium tree, another medicine, religious affection. Also Lycopodium. So we learn Lycopodium in the medical paper, but maybe we never thought that Lycopodium has so much religious affection. But you see, it is same like Lachesis. But most is Stramonium. Stramonium are very much religious. So Lycopodium patient, you keep in your mind. If he is religious since long time, okay, it's okay. But if you find some patient, suddenly he became religious, suddenly. And he's always thinking very seriously. So you must suspect that he has Lachesis mind. Now let us come also religious despair. He thinks that he will not have salvation in that day of Hashor. In the Hashor, he will go to he will go to hell, not in Jannah. So let us see the symptom. He has so despair, despair, religious, despair, religious. You see, religious despair of salvation. Salvation means to go to Jannah. He cannot cross the full Sirat. He will be caught in his giving accountability to God, and he will be taken to hell by the Feresta. He's thinking like this. So, and he's so much depressed for that. So you see the symptom. Lachesis in the first grade. Religious despair of salvation. That he will not go to Jannah. He will be caught by God. He did not do well in his life. So lachesis is this. But I don't say, don't think of lachesis in a really pious religious person who is practicing his religion nicely since long time. This is not patient. This is symptom, but that is not symptom. This is excessive affection. So you have to think, you find a good person having very religious mind and you give lachesis, no, this is wrong. So you will have to have good judgment to evaluate your symptoms. Now let us come weakness of memory, delusion. Yes, we said that there is delusion that lachesis thinks he is under control of a superpower. Oh, there is a big one above. He is giving him order. Do it, don't do it, something like this. And sometimes if you live with a schizophrenic patient in the house, I had one patient before maybe a few weeks. I warned the parents because their son is schizophrenic. I said, treat him well or keep him in an asylum. Don't live with him so long time. Is that why? I said, because he thinks he has delusion that somebody is giving him order. Maybe he will have the order that your father is the bad one. He is doing all the problem in your life. So kill him. Yes. He may have delusion like this. And you know, when you are lying, when you are sleeping, he will just cut your throat. It is dangerous to live with schizophrenic relatives in the same house without treatment. So you must treat him well. If he is schizophrenic, and he will not go to jail after killing somebody because he is psychic patient. So lachesis says this thing. He thinks that he is under the control of a superpower, and you will have to obey his order. So let us see in the repertory. Let us see in the repertory how it is represented. Delusion, superhuman. You see, there is delusion. He thinks that he is under control of a superhuman. Here, another snake medicine, Naza. Lachesis, Naza, and Tuza. You know, Tuza has fixed idea. Also like this. He has so many delusions, Tuza. He thinks there is a baby, unmarried patient. He thinks there is a baby in the abdomen, in the uterus. This Tuza. And lachesis says, you see, lachesis, Naza, and Tuza. So they think that they are under control of a superhuman and they must obey his order. They say, tomorrow go and kill that person. And he will kill without knowing any consequence. So this is very dangerous. And he thinks that he is under influence, under a powerful person. Let us see influence. delusion, influence. You see, what is the rubric? He thinks he is under a powerful influence. This is the same symptom. He thinks he is under a powerful source, powerful influence. Maybe big shaitan, this Iblis controlling him. Or maybe he thinks that this is God. So this is, you see, hyoscyamus and lachesis. So these two symptoms we find, maybe you also find, in schizophrenic patient particularly. Those who are schizophrenic patient, you find such symptoms. And sometimes we give lachesis also. And if you can choose lachesis in a schizophrenic patient rightly, you may cure this patient, even schizophrenic patient, by lachesis. So learn lachesis very carefully. It will repay you 100 times. Now you see, he has another symptom. He thinks he had two wheels. He had two wheels. One wheel is saying to do some good thing, another wheel is saying not to do it. Like an accordion. And he's in a dilemma what to do. One is saying, tomorrow do this good thing. The other says, no, this is a very bad thing, don't do it. So he's in a dilemma. So let us see the symptom. Let us see the symptom. That's why I tell you, those who are serious, please bring your repertory and do repertorization along with me. Sure, your repertory skill will increase. Will, because these are very chosen symptoms. Will, two wills. You see, this symptom is very intensified in anacardium, I tell you. Very intensified in anacardium, but also in lachesis. Anacardium has too much duality of symptoms. He cannot decide what to do. So you see, what is this? It is written, he has two wheels. Sensation as if he had two wheels, and sensation as if he had two wheels. One is commanding and other is forbidding. One is commanding to do and other is forbidding. So these both symptoms, these are very important for such medicines. Also, I tell you, lachesis is very important for curing, treating behavioral problem in a child. Nowadays, I find, sure my colleagues also, they find it like this. Many child are coming by their parents having autism, ADHD, attention deficit hyperactive disorder, then behavioral disorder, behavioral problem. These sort of patients are coming more and more. And there are many medicine, of course, can be used, but some medicine coming more in such patient, in the symptomatology of such patient. Say, for example, you find Beraitakar, you find Biforana, you find Tarantula, you find tuberculina, you find Medorina, you find lachesis. So if you have good command on such medicines, there are other medicines also, you will find that these patients are never cured by allopathic doctors. No. Autism has no cure. ADHD has no cure. But you can cure them. Though this is very tough to select the medicine in each phase, but if you can select the medicine, you can give hope to a family. Because I see only single child of ADHD, attention deficit hyperactive disorder, is ruining the whole family. He's keeping busy his mother and father. They cannot do any work, and he's breaking this thing, throwing that thing from the house, and like this, and has no treatment. So lachesis is one. So let us go to the symptoms. Behavioral problems. There is a rubric, behavioral problems. Let us come. Behavioral problem. You see, behavioral problem. There you find many medicines, Stramonium, tuberculinum, also there is lachesis. Tuberculinum is a good medicine for ADHD. Of course, symptom must agree. Also Stramonium, also Buforana, also Tarantula, and also lachesis, also Medorina. Very important medicine, Medorina. We'll discuss next time all these things. Then you find behavioral problem in children. Behavioral problem in children, you see. Behavioral problem in children. Also you find lachesis, then you find Stramonium, you find Tarantula. Very good medicine. If you want to treat such patient, as I said, this medicine must be mastered by you. What are the medicines? I tell you, Veretakar, Buforana, Tuberculinum, Tarantula, Carcinosin, Medorinum, lachesis. There are others, but these are mostly you find the picture in such child. If you can master this medicine, you can master the treatment of such hopeless patients. Now you find contradiction, disposition to contradict. Lachesis patient, I told you, it does not tolerate any authority. He will not. Maybe he's general secretary of an organization, but he will not tolerate the order of his president. He is not tolerating the order of his father. He is not tolerating the order of his teacher. So let us see. Disobedience is called disobedience. Disobedience is not obedient. Disobedience. You can see. Disobedience. Disobedience. Disobedience you find, you see. All the medicine I told you. Lachesis, then Medorinum, then Tarantula, Tuberculinum, all these. Even Syphilinum. Sometimes this will come Syphilinum as well. So these are very important rubric and important medicine. And then disposition to contradict. Anything his father says, he will no, I will not go. His mother said, go to market to bring, no, I will not go. He's got this disposition to contradict. So let us see the symptom and we finish our mental symptoms. This is called contradiction. Contradiction. Disposition to contradict. You see, disposition to contradict. You find lachesis. Disposition to contradict. And no, I will not do. Even good thing, no, I will not do. This disposition to contradict. This is disobedient child, disobedient person. So you find all these rubrics cover the mental symptoms of lachesis. I took long time for repertorizing these symptoms. Why? Willingly. Because this will help you, maybe not for the senior doctors, at least for the juniors and students, or those do not have much knowledge of repertory. This will help you how to repertorize intelligently the symptoms, and it will increase your knowledge of materia medica. Because you find here with the this is called quantitative evaluation of symptoms, the grade. You see the grade here. Say you see lachesis is first grade. This was to contradict. Disobedient. You find lachesis in high grade. So you give importance to this symptom. Now we'll finish. We have finished general symptoms of lachesis, then mental symptoms of lachesis. We will go to particular symptoms of lachesis now. But as I tell you, this is the style of my studying materia medica, and this is instructed by my guru, Dr. J.N. Kanjilal. This way I studied materia medica. We'll study the particular symptoms from head, throat, eye, ear, stomach, and this and that. Only the important symptoms. Only the important. Other unimportant or common symptoms we will not discuss. There are many in the books. So let us go to the materia medica again. Let us go to the materia medica again. I think you can see anybody can say me? You can see the Mathematica? Can you see?
Yes, sir.
Hello.
Yes.
Okay, thank you. Thank you. Let us go to head symptom. I told you only the important symptoms we will mention in the particular side. But this symptom you must know. I'll show you. If you know these good symptoms, you can treat many incurable patients, incurable with allopathic doctors. So please try to give your attention. In head, we will give importance to headache. Because Lachesis has a good number of cases you find they have headache. Now, what is the character of Lachesis headache? So many medicine has headache. This will be unilateral, mostly unilateral, in one-sided. This is called migraine, sick headache. And mostly this will be on the left side, number one. Number two is sensation. His sensation will be hammering type, as if somebody is hammering his head or pulsating. His artery is pulsating like this. So this will be a migraine head type of headache, unilateral, mostly on the left side, and there will be pulsating, hammering type of symptoms. And particularly you find this headache will be more without discharge, before discharge, like menses. If a patient woman says she has always headache before mens, when mens starts, headache goes away. This is Lachesis symptom. Or during pregnancy, she said, I never had headache, but when I got pregnant, I had headache. Why? Because her menses stopped. Or patient will say in menopause, she said, never ever in my life I had headache. But since I had menopause means permanent cessation of mens. In our country, from 45 to 50 years of women, they lose their menstruation. This is called menopause. So menopause also, this is stoppage of discharge. So that time, if there is headache, you can think. And also another modality we know from the general one, that after sleep, the patient should be fresh, feeling fresh in the morning after sleep. But Lachesis doesn't know. Even after sleep, you will have headache. You will be sad. You will be annoyed. And the way he will sleep for a longer time, his headache will be longer. He slept for 5 hours, you will have less headache. He slept for 10 hours. A nice sleep, you will have more headache. This is a peculiar symptom. 153 to 154 aphorism of organon. So when the patient wakes up from sleep, he has headache. And as soon as he go to sleep, also he has headache. And all headache ameliorated by discharge. He said, I have headache, but as soon as I have nasal discharge, headache less. As soon as I have epistaxis, headache, no more headache. As soon as I have mens, headache finish. So these are the headache symptoms of Lachesis. You see, it is connected with Lachesis, general symptom. Now another symptom you find, Lachesis have burning and heat in 2 places more. One is in the head, in the buttocks, another in the feet, sole of the feet. Patient will say that after my menopause, always I have hot flash. She has a hot flash going from down to her head, and legs in the feet there is burning. So this is very important Lachesis symptom in menopause. We say menopausal syndrome. When a woman has cessation of mens, this is called menopause, she will have some symptoms. This like headache, hot flash, she will have palpitation, she will have trembling, she will have irritable mind, and she will have sleeplessness. This symptom called menopausal symptom. A woman goes to menopause, she is having such symptom. And if you give Lachesis, there are other medicines also. There is sulfur, there is graphitis, and other medicines. But if it fits lachesis, it will help her tremendously. Now another good symptom, I tell you, lachesis is a good medicine for chronic sunstroke. You have gone to sun heat and you have headache and stroke, sunstroke, something like this, and you are vomiting. This is acute. Lachesis will not come. There will come glonoin, belladonna, some medicine like this. But if it is chronic, you are working in sun for a long time, and now you have too much headache and sunstroke, then lachesis will come to help you. So lachesis is enemy of sun rays, or you can say sun heat is the enemy to lachesis. That's why he said this is one of the best remedies for sun headache. Now I give you another symptom, very important symptom, and even I did not know it without studying this repertory. That falling of hair during pregnancy. One medicine and first aid. This is lachesis. If a patient is pregnant, patient say, after my pregnancy started, I am having falling of hair. I'll show you in the repertory. First aid, single medicine. Of course, other medicine may come if other symptoms agree, but this is a very important symptom. So let us say another one, then we'll go to repertory and we'll finish today. So this is head. Now let us come to eyes. Very important symptoms and very important medicine for some eye disease, I tell you. First thing is that this is anemia of sunlight, I told you. So lachesis has intensive photophobia. He cannot see sunlight, even the artificial light at night. So this symptom is very important, though it is particular symptom, intense photophobia, number one. Number two, he has hemorrhage in the eye. Oh my God, a very dangerous thing. Patient may have subconjunctival hemorrhage superficial, or maybe in the deep. There is retinal hemorrhage, retinitis, retinal inflammation, or even maybe retinal detachment, vitreal hemorrhage. Patient will say, since yesterday I cannot see anything by my right eye or by my left eye. It was good before, but now there is too much pain and everything is blurring, blurred vision. I cannot see. Then she said, I went to the doctor. He said, you have bleeding inside your eyes and you need to have laser treatment. Laser treatment to control this hemorrhage, to stop this bleeding. And it will take so much money. And she said, I don't have money. That's why I came to you. And we have a good medicine in lachesis. Of course, not only lachesis, there are other medicines. Lachesis, Crotalus horridus, phosphorus, arnica. These are very good medicine for hemorrhage inside the eye. Very good medicine. And if the lachesis symptom fits, give lachesis, no need of your laser or anything. So that's why this symptom you just keep in your mind. Hemorrhage inside the eye, particularly left eye, but you must have lachesis symptoms, mentality and general. Then you give, it's all right. You see this symptom, this Crotalus horridus, phosphorus and arnica. In ear, then I finish. Ear has not too much symptom of lachesis, but a very good symptom. This is called Eustachian catarrh. I hope most of our participants here, you know the Eustachian tube, pharyngotympanic tube. There is a tube connecting the middle ear with the nasopharynx. This is called Eustachian tube. So you have any infection here, the child has tonsil, it will go to middle ear and there will be pus in the ear. There will be purulent discharge from the ear. This is called Eustachian tube. So there is Eustachian catarrh, and the tube will be blocked by taking cold. The guardian will say the child took cold and he said he has pain in the ear, and the pain, there is stop sensation. Stop sensation. This is closed. He finds that he does not hear anything. Or maybe some patient will find they have tinnitus. They will say, I have noises in my ear. Noise in the ear from after sleep up to I go to sleep. Always various types of sound. There may be buzzing sound, there may be blowing sound, there may be sound of birds, like this. So if it is on the left side, and if it is aggravated after sleep, lachesis is a very good medicine. Left side and aggravated after sleep. Let us finish today our particular symptom. Inshallah, next day we'll start from nose up to finish. I hope next day we'll finish it. So I am going to repertory again only to show you that these rubrics, few rubrics. Going to repertory. Okay. Now let us see the symptom of head. I tell you the symptom of head because time is very short. That's why I show you the most important one. I say there is falling of hair in a woman during pregnancy. This is single medicine first grade. Let us go here. Let us go here. Hair falling, pregnancy. You see, there is single medicine. That to first grade. Hair falling during pregnancy. Single medicine first grade. But it does not say that you find and give lachesis then and there. No. It is homeopathy is not like this. But it gives you a good idea that yeah, the patient may have lachesis symptom. Then you search other symptoms. If you find some other important generals or some mentals, you can give, and this will help the patient. Now let us see another symptom. Sun exposure to sun. Patient has headache from sun. This is important symptom. Let us see this one. Let us see symptom. Pain, sun, exposure to sun from. You see. The patient has headache from exposure to sun. Particularly if it is chronic, lachesis will come more. If it is acute, more will come glonoine, belladonna, antim crude, bryonia, like this. But if it is chronic, so you see, lachesis is the first grade. Now let us go to the eye. The most important rubric I show you. I told you bleeding from the eye, bleeding inside the eye. So let us see the medicines. Bleeding from eyes. First is this one. You see, all the snake medicines have much effect on eyes, I tell you. So now we have started all the snake treatment. All will finish, inshallah. This lachesis, then we'll go to crotella, then we'll go to elapse, then we'll go to botox. So we'll finish all. So here you see, bleeding in the eyes, bothrops, this is a snake medicine. Crotellus horridus, this is a snake medicine. Lachesis, this is a snake medicine. Also elapse, snake medicine. But mostly you find bothrops, crotellus horridus, lachesis, phosphorus. And if it is from choroid, this is called choroidal bleeding. Lachesis is very big choice. And if it is retinal hemorrhage, you see retinal hemorrhage in the retina, particularly those who have diabetes, uncontrolled diabetes, they will have first retinitis, retinal inflammation, then retinal hemorrhage, and there will be loss of vision. There will be retinal detachment. So you see, lachesis is the only first aid medicine in retinal hemorrhage. It is the only first aid medicine. So if you have a patient of retinal hemorrhage and if you find other general mental symptoms supporting lachesis, you can give very confidently this lachesis. Even retina inflammation of retinitis is very common in diabetic patient, and patient lose the vision. Let us see this one also. Retinal inflammation, and we will finish today. Inflammation retina. You see inflammation retina, arnica hypericum lecacis. Arnica hypericum lecacis. And if it is hemorrhagic retina, you find lecacis in the first grade. So with this, we'll finish today our lecture. I tell you, if we homeopath, we learn our materia medica very well, and we learn our repertory very well. You see, repertory, and my guru, Dr. Pramadanand Das of Sylhet, he used to say, repertory and mathematica are like twin brothers. One is indexed to other. How nice he was saying that. That guy, Pramadanand Das, he was BA in 1918 and DMS from Danhan Homeopathic College of Kolkata. He was the most senior homeopath of Sylhet, very good homeopath. He was my first guru. He was saying mathematics and repertory are like twin brothers. One is indexed to others. So we, even after this 4.5 decades, we find that his teaching is true. You learn mathematica and repertory well together, and this will help you in selecting your medicine in critical cases. So we hope to continue such teaching later on, and I hope those who are present in our lecture, they will learn our style of learning materia medica, and I think you don't find it in many other places. So this will help you, those who are very serious. If you see, your knowledge of materia medica has no bound. You can learn only from Ghotok, 3 volumes of Ghotok, and Oshut Parichaya, or maybe some other books. And you confine your knowledge of medicine of materia medica these books. Okay, it's okay, but you become a doctor, parivarik chikitsak, domestic physician, or maybe you can practice in a small locality. But if you find in a place that very complicated patients coming to you from allopathic hands, from various districts of country, it comes to homeopaths, then you cannot limit your study and knowledge of mathematica in such small books and easy books. You will have to go to the source, as I said in my first lecture, primary text, secondary text, tertiary text, and also you learn mathematica by studying repertory rubrics. Then it emphasizes and it increases your grips on mathematica. And I tell you that the homeopath who knows mathematica more than his colleague, then he is a better doctor than his colleague. You will learn all the subjects, but mathematica too much, without any limit, without any bound, then you become a very good doctor. You know mathematica less, you are a less doctor. So please, this is only from my experience I am telling you, and the advice of my teachers. They emphasize the learning mathematica by any depth. So with this, I am finishing today. I am returning microphone to our anchor, Dr. Anwar Patwari. We can take some questions, and then we'll finish maybe before 11. Okay, thank you very much for patient listening. Assalamu alaikum wa rahmatullah wa ma tawfiqi illa billah. Dr. Anwar Patwari.
Thank you very much, sir, for your very good and very valuable presentation. কারো কোনো প্রশ্ন থাকলে আপনারা আমরা মাইকগুলো আনমিউট করে দিচ্ছি, আপনারা প্রশ্ন করতে পারেন, অথবা কোনো মন্তব্য যদি থাকে তাহলে মন্তব্য করতে পারেন। কারো কোনো প্রশ্ন থাকলে বা মন্তব্য থাকলে আপনাদের প্রশ্নগুলো করতে পারেন, মাইকটা আনমিউট করে অথবা হ্যান্ড রাইজ করলে আমরা একে একে আপনাদের নামগুলো ঘোষণা করতে পারবো। ডক্টর মোহাম্মদ মাহমুদ, ডক্টর মাহমুদ, জি আপনার প্রশ্নটি করুন। আপনার মাইকটি আনমিউট করুন প্লিজ।
আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহ।
ওয়ালাইকুম আসসালাম রহমতুল্লাহ।
স্যার
বলেন।
স্যার, আমি মাহমুদ স্যার, আমি নাটোর থেকে শুনছি। দিনাজপুরের ফুলবাড়িতে আপনাকে নিয়ে কবিতা লিখছিলাম স্যার, আমি সেই মাহমুদ।
ওকে, থ্যাংক ইউ।
থ্যাংক ইউ স্যার। কোন কোন ইংরেজি স্যার একটু আমরা বুঝতে পারছি না, তো তাছাড়া মোটামুটি খুব ভালো লাগছে স্যার। আমি
No
একদম
problem.
প্রথম শুনেছি, খুব ভালো লাগলো স্যার। এবং আমি দুইবার আমার একটু নেটওয়ার্কের সমস্যার জন্য একটু কেটে বিচ্ছিন্ন ছিলাম। খুব ভালো লাগছে স্যার, আপনাকে অনেক অনেক ধন্যবাদ স্যার। আল্লাহ আপনাকে নেক হায়াত দিক এবং আমাদের অগ্রযাত্রা সফল হোক, এই কামনা করছি স্যার। থ্যাংক ইউ স্যার।
Thank you.
আসসালামু আলাইকুম।
Thank you. ওয়ালাইকুম সালাম রহমতুল্লাহ।
থ্যাংক ইউ স্যার।
জি আপনাকে অসংখ্য ধন্যবাদ। আপনি আহ, আমাদের সাথে যুক্ত ছিলেন। আর আরেকটা বিষয় আমাদের স্যার বলেন যে আসলে শুনতে শুনতে আমাদের অভ্যাস তৈরি হবে। হয়তো আমরা সম্পূর্ণটা বুঝতে পারবো না, কিন্তু এই ক্লাসটায় থাকার পরে যখন আবার বাংলা ভার্সনের ক্লাসটাতে আপনি থাকবেন বা আমরা যারা থাকবো, তখন আরো ভালো বুঝতে পারবো। তো এই যে মেডিসিনটা নিয়ে 4টা ক্লাস আজকে শেষ হলো, আরো একটি ক্লাস হয়তো হবে। আশা করি ঈদের পর থেকে আমরা আবার আমাদের বাংলা ভার্সনের এই একই মেডিসিনের আলোচনাগুলো আমরা শুনবো। আমরা এই ক্লাসগুলো শুরু করার আগে স্যার বলেছিলেন যে আহ, একটা মেডিসিনকে কিভাবে ডিটেইলে পড়া যায়, ইনডেপথে এটাকে কিভাবে স্টাডি করা যায়। আমরা হয়তো একটা মেডিসিনের 10, 15, 20টা মেডিসিন হয়তো আমরা সবসময় আমাদের মাথায় ঘুরপাক খায়, আমরা এটা নিয়েই অনেক সময় প্র্যাকটিস করি। কিন্তু একটা মেডিসিনকে ডিপলি স্টাডি করলে আসলে সেটার প্র্যাকটিস লেভেলে গিয়ে বা আমাদের বাস্তব রোগী চিকিৎসায় আমরা আসলে কতটুকু বেনিফিশিয়ারি হতে পারি বা কিভাবে আমরা ওই স্টাডি গুলো করবো, এই ক্লাসগুলো থেকে মূলত আমাদের ওই দিক নির্দেশনা গুলোই আসলে দেয়া হয়। আর কারো কোনো প্রশ্ন থাকলে হ্যান্ড রাইজ করলে আমরা নামগুলো ঘোষণা করতে সুবিধা হবে, অথবা আপনাদের কোনো মন্তব্য যদি থাকে আপনারা মন্তব্যগুলো করতে পারেন। আর আমাদের একটা ডক্টর বিপ্লব সরকার, উনি একটি মন্তব্য লিখেছেন, স্যারকে ধন্যবাদ দিয়েছেন। যদি আমাদের আর কারো কোনো প্রশ্ন বা মন্তব্য থাকে হ্যান্ড রাইজ করলে আমরা নামগুলো ঘোষণা করব। ডক্টর দীপক কুমার দাস, জি আপনার প্রশ্নটি করবেন।
আসসালামু আলাইকুম স্যার। স্যার
ওয়ালাইকুম
অনেক
সালাম।
সুন্দর আলোচনা হয়েছে স্যার, খুব ভালো লাগছে স্যার। ইংলিশটাও বুঝতে পারছি স্যার, বাংলা ক্লাসটাও করব। স্যার এখানে অনেকগুলো মেডিকাল নাম বলা হয়েছে যে আপনার লেকচারে। স্যার আমরা এই বইগুলো পাবো কোথায় স্যার? আমরা তো পাই না। আমি তো স্যার ময়মনসিংহ খুঁজি। হ্যাঁ, আমি ময়মনসিংহ দিয়েছি, ভর্তি দিয়েছি হোমিও মেডিকেলে, কিন্তু এখানে তো কোনো বই পাচ্ছি না। এটা ডিটেলস করেই পড়তে চাই, কিন্তু এরকম ভাবে পাচ্ছি না স্যার। এগুলো কোথায় পাবো কি স্যার, এটা বুঝতে পারতেছি না স্যার। স্যার এটাই
You
আমার
see,
প্রশ্ন।
okay. Thank you very much for your question. You see, Mathematical study, I told you in my first lecture that it is phase by phase. You cannot learn all the Mathematica at a time. So you go phase by phase. In first phase, you read some books and have some idea about the medicine. Then after some practice, some years, you take another phase of studying Mathematica. And you enlarge your grip on books, and you collect more books and have more ideas. In this way, every year you are learning Mathematica more and more. I started learning Mathematica in 1977. Now also, I am now 67 years old, and I studied homeopathy since last 46 years. Still now, Mathematica is a very good subject for me, and I study every day. And unless you study Mathematica more and more, I tell you, you cannot be a good homeopath. No, you cannot be. And if you practice in Dhaka, you find nowadays so many patients, complicated patients coming to homeopathic fold to us for homeopathic treatment. We never saw such patients before 30 years. And to deal with such complicated patient, your grip on Mathematica and repertory. Very good. Must be very firm. That's why I'm telling you, those who are serious here, there is no alternative to learn Mathematica so much, and your time of studying Mathematica will you repay 100 times. If you don't know the medicine well, you know all other subjects of homeopathy, you cannot be a good prescriber. To be a good prescriber, you must have good grip on Mathematica as well as repertory. Mathematica first, and also repertory. Thank you.
থ্যাংক ইউ ভেরি মাচ। ডক্টর শাহানাজ সিদ্দিকা, আপনার প্রশ্নটি করবেন।
Ji, Assalamu alaikum, sir. Assalamu alaikum to everybody who is attending the class. আমি শাহানাজ সিদ্দিকা। জি স্যার, আপনি একটা ওয়ার্ড টার্মিনোলজি ইউজ করছেন, disposition to contradicts.
Yeah.
I have a little confused about this thing. Yeah.
Yeah.
Can you please explain it to me?
Disposition means willing, disposition means tendency to contradict. You say anything, I'll not agree. His father said, okay, let us go to market. No, I'll not go. He will say, let us go to take bath. No, I'll not go. So he has tendency to contradict to anything and everything. He does not like any authority, any order, any suggestion. No. What he knows, what he will do by himself, only this thing. This is called disposition. Disposition means tendency. Tendency to contradict the opinion or order or suggestion of others. Okay?
Okay, that means he doesn't want to listen to anyone.
Yes, anyone.
Okay, right.
He does not want
Like he's the
any
boss.
authority. Yes, he's the boss. Yes, yes.
He's the
He
boss.
does not like any authority. He is not like any authority. You see
Okay.
the difference between Staphysagrия and Lachesis. I tell you in this point.
Yeah, you
Staphysagrия-
mentioned about Staphysagrия the other day too. Like, if you are dominated by the Lachesis,
Yes,
and you're going to
yes.
be one time you're going to be Staphysagrия. I just forgot about that. Yes.
So this Staphysagrия just opposite to Lachesis. She or he
Okay.
will absorb the pressure by the husband, by the father. Maybe father is
Yeah.
very dominating. It does not give any chance to the boy. So this boy is afraid, and he is just suppressing his anger, suppressing desire, and ultimately he becomes ill. So this is Staphysagrия. He is dominated,
Okay.
suppressed by his superior. Lachesis is just opposite.
In my
He will
mind, I was
contradict
looking
any
for that
authority.
Staphysagrия. Yes. That's nice.
Okay,
Yeah,
okay.
thank you so much.
Welcome.
Yes, hopefully we're going to be together on like after Ramadan, I think after Eid, inshallah.
Yes, inshallah.
ইনশাআল্লাহ।
Inshallah. So yeah, it was, I feel like I'm just surrounded by the Lachesis like all the time. Thank you so much, sir. Okay.
Welcome.
Allah
থ্যাংক
Hafiz.
ইউ ভেরি মাচ। আরেকজন হ্যান্ড রাইজ করেছেন, স্যামসাং A7, উনি নামটা রিনেম করেন নাই।
No, he must change the name, then he will ask question. You tell him to change the name because we cannot count him.
আপনি আপনার মাইকটা একটু আনমিউট করে আপনার প্রশ্ন অথবা মন্তব্যটি করবেন।
স্যার আসসালামু আলাইকুম স্যার, আমার নাম রেবেকা সুলতানা, গভর্নমেন্ট হোমিওপ্যাথি মেডিকেল কলেজ থেকে স্যার আপনার স্টুডেন্ট। স্যার আসলে আমার আপনার স্যার কালকে বিগত যে ক্লাস প্লাস আজকের ক্লাস ম্যাম যে কোশ্চেনটা করলো কন্ট্রাডিক্টরি, মানে স্যার আমি জিজ্ঞেস করতে যাচ্ছিলাম যে চাইল্ড সিমটমে স্যার আপনি যেটা বলেছেন যে খুব জেলাসি থাকে, বাচ্চারা তার মানে ভাইকে সহ্য করতে পারে না। যদি আদার্স ধরেন কোনো ছোটবেলা থেকেই বেবি যদি এরকম থাকে যে মা তার বড় ভাইয়ের দিকে ঘুমিয়ে আছে, সেই ক্ষেত্রে সে মানে ভাইকে সরিয়ে দিয়ে তার পাশে মায়ের পাশে যাবে। এবং স্যার বড় হওয়ার পরেও তার যদি বিহেভিয়ার ডিসঅর্ডারের প্রবণতা থাকে, বা যে স্যার আপনি যেটা বললেন যে কন্ট্রাডিক্টরি সে আদার্স এর সাথেও করে, বা ওই যে স্যার আপনার লেকচারে যেটা বললেন যে সে কোনো অথরিটির কোনো কিছু মানতে চায় না, বিশেষ করে সে পড়তে তাকে যদি পড়তে বলা হয়, সে যদি বলে যে না আমার পড়া ভালো লাগছে না, স্যার এই ক্ষেত্রে কি মানে ল্যাকিসিস ইউজ করলে বা তার যদি হট পেশেন্ট হয়, সেই ক্ষেত্রে কিন্তু তার ক্ষেত্রে স্যার কি বিহেভিয়ারের চেঞ্জ আসতে পারে?
Okay, thank you very much for your question. You see, I told in this lecture that nowadays we are receiving many patients, I tell you, every day few patients. Autism, ADHD. ADHD means attention deficit hyperactive disorder and behavioral problem. These three sort of, why? Because they go to pediatric neurologist, child neurologist, and pediatrician, and psychiatrist maybe. But you know, in modern medicine, there is no curative treatment for such things. They only maintain, they only control the symptom. But in homeopathy, you know, because our etiology of disease is different than that of conventional medicine. So if you can diagnose his miasm and treat him, because these are not acute disease, this is miasmatic, came from father sometimes, from the family, from the environment, and you can select correct medicine, and you cannot expect that by a single medicine such patient will be cured, because Hahnemann said chronic miasmatic patient needs a series of medicine. Maybe first you find in his behavior there is syphilitic behavior, he's breaking this thing and that, you give him anti-syphilitic medicine. Maybe after some time you find that their symptomology changes. Then you give another medicine which fits to the new situation. Then another medicine like this. So by a series of medicine, gradually you can cure the patient medicinally. And even if you cannot cure totally, but you can help the patient more than the modern medicine. So that's why you need not 1-2 medicine, you need the whole Medica in your grip. But also you will have to know that there is a group of medicines for groups of patients sometimes, because a patient of ADHD, attention deficit hyperactive disorder, they have behavior stereotype. If you take the history of say 20 patients of ADHD, you have the good idea about the ADHD patient, and also you have good idea about all the medicines which are having symptomatology like this symptom, and you study this medicine again and again, and you have a grip on that medicine. Then you find it is easy for you to select medicine for the patient. Now, for this patient, not only lachesis, sometimes you find tuberculinum will come, sometimes you find tarantula will come. Patient says, mother says, child is very much fond of seeing music and dance, and sometimes he makes dances also, and he will act how his father is doing something. So this is just following others, acting others, and he's very much restless and destroying things and that. So you find that tarantula will come. Sometimes you find medorinum, very has much behavioral problem in a very restless patient. Sometimes you find Bufforana. Sometimes patient always handles his penis and he has erotic behavior. One patient said, her child, only 5-year child, he said always he comes to my loin, mother said, and rubbing his penis on my loin. You see, this is a symptom. She said. So you find other medicine, you find Bufforana. So you cannot say that this medicine will cure this patient. You need a group of medicine, and you must be very much intelligent how to select medicine in each phase. That you can help. Of course, this is a little bit tough to select medicine for such patient who cannot talk. You see the behavior and you take the hints from the parents and then you select the medicine. But it is possible. Thank you very much.
থ্যাংক ইউ স্যার।
Yes, doctor. Yes.
আর কারো কোনো হ্যান্ডস দেখতে পাচ্ছি না। শাহানাজ সিদ্দিকা ম্যাম কি আর কিছু বলবেন? হ্যান্ড রেজ করেছেন।
আমি আমার আরেকটা প্রশ্ন রয়ে গেছে। You know, I'm very stubborn person. So, so you during the menopause, you mentioned about like hot flashes is going from feet to head, right? What does it mean? Is that the hot flashes, but the patient কি মনে করবে যে ওর পায়ে থেকে গরম শুরু হয়েছে, এরকম বলবে?
No, he may say anything. He may say from feet to head. He may say from here, from heart. There is something going to my head.
I was a little confused about that. Okay. Thank you, sir. Okay,
welcome.
সবাইকে আবারও ধন্যবাদ জানাচ্ছি। আর কেউ কোনো হ্যান্ড রাইজ করেননি, আশা করি কারো কোনো প্রশ্ন বা মন্তব্য নেই। সবাইকে আন্তরিক ধন্যবাদ আবারও জানাচ্ছি যে আপনারা ক্লাসের শুরু থেকে এখন পর্যন্ত ধৈর্য ধরে আমাদের ক্লাসে উপস্থিত আছেন। নিশ্চয়ই আল্লাহ রাব্বুল আলামিন আমাদেরকে যদি আবারও সুস্থতার সহিত হায়াতে তাইয়্যিবা দান করেন, আমরা আফটার রমাদান আপনাদের সাথে আবারও আমাদের এই কন্টিনিউয়াস আলোচনায় আমরা যুক্ত হব ইনশাআল্লাহ। ততদিন পর্যন্ত সবাইকে আল্লাহ রাব্বুল আলামিন সুস্থ শরীরে সুস্থ হায়াত এবং দীর্ঘ হায়াত দান করেন, এই জন্য দোয়া করছি। আর সবাই আমাদের যে ফেসবুক পেজ আছে এবং আমাদের যে মেসেঞ্জার গ্রুপটা আছে এবং আমাদের প্রত্যেকটা জেলা কমিটির এবং কেন্দ্রীয় কমিটির কয়েকটা মেসেঞ্জার গ্রুপ আছে, যারা যেখানে আমরা যুক্ত থাকি, আমরা নোটিশগুলো যখনই পাবো সেগুলোকে আমাদের পার্সোনাল টাইমলাইন এবং আমাদের ফেসবুক যে পেজটা আছে সেখানকার নোটিফিকেশন গুলো আমরা একটু শেয়ার করে দিয়ে অন্যদেরকে একটু অ্যালার্ট করে দেবো। নিশ্চয়ই রমজানের পরে আমরা আবারও আত্মশুদ্ধির এই মাসে নিজেদেরকে আত্মশুদ্ধিতার মধ্যে এনে আমরা যেন আত্মমানবতার জন্য আরো ভালোভাবে নিজেদেরকে প্রস্তুত করতে পারি, সেই দোয়া রব্বুল আলামিনের কাছে থাকবে। সাথে সাথে সবার সুস্থতা কামনা করে আমাদের স্যারদের স্পেশালি আল্লাহর দরবারে দোয়া করবো যে আল্লাহ তাদেরকে যেন দীর্ঘায়ু দান করেন, সুস্থতার সহিত আমাদেরকে আরো বেশি এই মানবতার সেবায় নিজেদেরকে যোগ্য করে তোলার তৌফিক যেন আল্লাহ আমাদেরকে দান করেন। এই প্রত্যাশায় আজকের মতো এখানেই বিদায় নিচ্ছি। সবাই ভালো থাকবেন, সুস্থ থাকবেন, সুন্দরভাবে কাটাবেন আপনাদের জীবনের প্রতিটি মুহূর্ত। এখানেই শেষ করছি। আল্লাহ হাফেজ। আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু।